And we begin tonight with an eye toward California reopening. June 15th is the day circled on a lot of calendars. Thanks for joining us. I'm Catherine Garcia.
I'm Mark Mullen. Good evening. So June 15th, of course, is the day that Governor Newsom is planning for the dramatic reopening of the state. But interestingly enough, that date is just about 2 weeks after the Memorial Day holiday that just passed, of course. And if pandemic history has told us anything, cases tend to rise right after a holiday.
Well, we wanted to find out if this time would be any different, at least what experts are thinking about this. So NBC7's Omari Fleming did speak with some health experts who say this past holiday weekend is certainly a stress test of sorts for our vaccine efforts.
Maskless excitement abounded over the Memorial Day weekend, a sense of normalcy from the beaches to the first stadium concerts in more than a year at Petco Park.
Hope you like jamming too.
While Rasta vibrations were in effect, the full effect of the holiday weekend's gatherings, weeks away, say doctors David Pride and Paul Schalch Lepe.
Why is 2 weeks from now really critical?
You have exposure, and then about 2 weeks later is when you start seeing the spike in cases. 2 weeks after that is when, unfortunately, you start seeing the more severe cases that lead to hospitalizations.
So you're expecting to see the numbers tick up just a little bit? Do you expect them to explode like we have in previous vacation periods?
No, we don't expect them to explode. But the one thing to keep in mind is that right now we're functioning at a baseline of about 20,000 cases per day as a country. So that's actually quite a bit of COVID. And I know that it's a lot less COVID than we've had in the past, so a lot of us feel good about it. But when you think about 20,000 cases a day, that's still quite a bit of COVID, meaning that there is enough of the virus out there circulating to infect more and more people.
Both doctors say the state and county vaccination rates should help keep infections much lower than seen during previous holiday weekends, especially since San Diego County closing in on its vaccination goals. But there's still room for caution, according to a new report posted to the Journal of American Medical Association. Based on simulated spread in North Carolina, it notes that without social distancing, school closings, and masking, even with most people vaccinated, there could be a substantial increase in infections, hospitalizations, and deaths. Back here in San Diego, as the state moves to reopen June 15th, continuing to mask up met with mixed emotions.
I'm a medical professional, retired nurse, and I'm familiar with the whole wearing the mask thing, but it's just getting to be tedious and it's just uncomfortable.
I'll pick and choose my battles where the mask is needed for my own personal health.
How should people approach their mask wearing and distancing in the future?
I think if we incorporate this as part of our routine, perhaps not as extremely as we were doing it before, but it is a good thing. Look at the cases of the flu, for example. You know, we had like record low cases of the flu, record low of other respiratory infections, precisely because we were just following these very simple measures of distancing, hygiene, and mask wearing.
Omari Fleming, NBC7.